SCID is also severe combined immunodeficiency, and it is a universally really lethal genetic disorder in which children cannot make infection-fighting lymphocytes. There are a number of genetic causes for SCID, but the end pathway is that the children can't make lymphocytes to fight infections, primarily, viral infections and other opportunistic infections. And so we know that transplantation of the blood-forming stem cells is the only way to cure severe combined immunodeficiency. There are some subtypes which it's possible to give them enzyme replacement, but the definitive cure is really hematopoietic cell transplantation. And so kids with SCID, I think that if there's, because it's genetically inherited, if there's a background in the family of immune deficiencies, then the family would be looking for whether or not their child is affected, and they can do gene studies. However, sometimes the kids have spontaneous mutations, and initially they're born healthy. The babies are born healthy because they have protective immunity from their mother. So the transplacental antibodies get transmitted. But then over the course of weeks to months, as those antibodies fade away, then the children can present with, failure to thrive. They get chronic diarrhea. They get upper respiratory tract infections that linger, and then worsening and worsening problems like pneumonia. And sometimes they do present where they are so sick that they have to be in ICU care, and sometimes, unfortunately, these children die. This is changing in the US a lot because of newborn screening. So now we know that kids can be, in the heel stick assay when the kids are born, there is an assay that looks for poor lymphocyte development. And so then those kids get flagged, and so they can come to the attention of the pediatricians and the immunology specialists and the transplanters early. But there's still the possibility that kids are, it's determined late in their course and they're pretty sick at the time that they're diagnosed.